The broadcast is now starting. All attendees are in listen-only mode.
Hello, my name is Mike Willett at the Intertribal Council of Michigan's National Native Network. Welcome to the NNN and the Indian Health Promotion and Disease Prevention Technical Assistance Webinar Series, Cancer Risk Reduction in Indian Country. This webinar is titled, It Stinks, Secondhand and Thirdhand Smoke. This technical assistance webinar is being hosted by the National Native Network with Indian Health Service Health and Disease Prevention, which offers technical assistance and resources for commercial tobacco prevention and control throughout Indian country, and the Indian Health Service Clinical Support Center. Your presenters today are Allie Moore, Project Coordinator at Keres Consulting, and Jovian Henio, Certified Tobacco Interventionist Outreach Coordinator at Keres Consulting. We are pleased to offer continuing education credits for participants in this webinar. No commercial interest support was used to fund this activity. This activity is designated one contact hour for nurses. And to obtain a certificate of continuing education, you must be registered for the course, participate in the webinar in its entirety, and submit a completed post-webinar survey, which will be emailed to the attendees tomorrow. By the end of this webinar, participants will be able to examine the health consequences of secondhand smoke on youth, elders, and community members, implement strategies to reduce exposure to sticky commercial third-hand smoke, and employ discussions that empower community members to create environmental policies to protect their health from secondhand smoke. And now at this time, I'm going to go ahead and turn it over to Allie Moore.
Thank you, Mike, for the introduction, and thank you everyone for joining us today. It is an honor to be here and to present our presentation, It Sticks or It Stinks, Secondhand and Thirdhand Smoke. So this presentation is meant to address the harmful and addictive uses of commercial tobacco. We do acknowledge the place of honor and respect for the traditional uses of tobacco, and all references in our presentation today represent commercial tobacco only. As we begin today's presentation, we want to provide a brief introduction into the presenter's frame of reference. Jovian and I have worked for a project called Smoke-Free Signals, which is made possible through the support of the New Mexico Department of Health Tobacco Use Prevention and Control Program. Smoke-Free Signals services the 22 tribes in New Mexico with education, awareness, and advocacy resources around secondhand smoke protections in schools, in housing, health centers, and other community spaces. So this presentation has been adapted to speak to an audience representative of the country, but please recognize that our focus for the last 2 years has been on New Mexico, so we're looking through a prevention lens representative of the southwestern part of the U.S. So our presentation today will focus on secondhand and thirdhand smoke, so it's important to understand and acknowledge the presence of commercial tobacco use among American Indians and Alaska Natives. According to a 2013 data taken from the National Survey on Drug Use and Health, 43.8% of American Indian and Alaska Native adults reported use of commercial tobacco in the past month. As we will explore in detail today, the use of commercial tobacco cigarettes and emerging tobacco products is not a singular activity. And by singular, we mean it's not just impacting the smoker. The use of commercial tobacco cigarettes and vaping products has negative health implications for the people near the smoker, both during and after tobacco use. Commercial tobacco use remains a social justice issue, as I'm sure many of you know. Communities of color, low socioeconomic status communities, and the LGBTQ communities are heavily targeted by the tobacco industry. They experience higher rates of tobacco use that vary substantially across populations and subpopulations, and they suffer a greater burden of disease and death than the general population. And that's why this discussion on secondhand and third-hand smoke is so important.
Okay, thank you, Allie. Thank you, everybody. Thank you for having me here. So we'll just go ahead and jump right into this. So now that we have introduced the presence of commercial tobacco use among American Indian and Alaskan Natives, we will dive right into this. And so today's presentation, just as you've seen previous with the slide before, we will cover 3 learning objectives for the next 30 to 40 minutes. So as you saw before, I don't know if you got a chance to read it, but I'll just go ahead and just go through the 3. I'll just review really quick. So examine the health consequences of commercial secondhand smoke of youth and elders and community members. Implement strategies to reduce exposure to sticky commercial third-hand smoke. Employ discussion that empowers community members to create environmental policies to protect their health from secondhand smoke. Just a side note, the last 10 minutes, if you have any questions, I'll just reiterate that. This presentation, you can ask those on the side. So we look forward to the exchange of the conclusion of these slides. So, okay. So to begin, we'll get started with secondhand smoke. Secondhand smoke is the environmental smoke that comes from either the smoke being exhaled by the smoker of the commercial cigarette, cigar, hookah, and etc. So sometimes this is considered as mainstream. So some of you guys may be aware of that. And the smoke that is from the burning in of the lit product. So that's also considered as side stream. So the image to the right you may be familiar with as a product of the Department of Health and the Human Service. Furthermore, some of the highlighted text in this secondhand smoke is harmful to those who breathe it in because it contains more than 4,000 chemicals. Many of them are cancer-causing. When someone is smoking, the people around them are breathing in that smoke. That means they are also breathing in more than 4,000 chemicals and about 70 cancer-causing toxins. This is according to the Health Consequences of Smoking 50-Year Progress, a report from the Surgeon General. There have been a number of scientific studies detailing the health consequences of secondhand smoke. Exposure have been done. There are several major ones that we'll highlight today. Back in January 1993, the U.S. Environmental Protection Agency, the EPA, released a report titled Health Effects of Passive Smoking, Lung Cancer and Other Disorders, which examined the respiratory effects of secondhand smoke exposure. The report concluded that secondhand smoke causes lung cancer in non-smoking adults and respiratory illness, including asthma, especially in the youth and the younger generation. The report estimated that secondhand smoke exposure caused 3,000 lung cancer death in non-smoking adults every year in the U.S. The report also classified secondhand smoke as a group A carcinogenic. So basically what that means is there is no safe level of this type of exposure.
So the Surgeon General of the United States, that study showed how breathing secondhand smoke affects the body. The 2006 report confirmed many of the other reports that there is, first of all, there's no safe amount of secondhand smoke. Breathing even a little secondhand smoke can be dangerous. Second, breathing secondhand smoke is a known cause of sudden infant death syndrome, or SIDS. Children are also more likely to have lung problems, ear infections, and severe asthma from being around smoke. Secondhand smoke causes heart disease and lung cancer. And this next one I think is really important, and that is that separate no smoking sections do not protect from secondhand smoke. Neither does filtering the air or opening a window. So when we're looking at the impact of secondhand smoke on the elderly population specifically, we can reference a report from the California Environmental Protection Agency. This report said that exposure to secondhand smoke is related to subclinical cardiovascular disease and clinical cardiovascular disease. Most recently, a new study from the University of California, Berkeley, found that hardening of the arteries is related to an increased risk of dementia. There was a 6-year evaluation that revealed that elderly people exposed to secondhand smoke for 30 years or more were about 30% more likely to develop dementia than those without such exposure. So you're beginning to see some different health impacts based on the different populations within a community. In July of 2005, the Centers for Disease Control and Prevention released the 3rd National Report on Human Exposure to Environmental Chemicals. And the report provides some exciting news, including there's been a dramatic reduction in exposure to secondhand smoke. This was from 1998 to 2002. Fewer adults and children are being exposed to secondhand smoke, and that is a good thing. The report also suggests the need for more research into the health impacts of secondhand smoke exposure. According to the CDC director at the time, exposure to secondhand smoke continues to plummet. However, many challenges remain. CDC is steadfast in its commitment to health protection, including protection from environmental threats, and this would include secondhand smoke. Okay, so we're continuing to look at what data is available, and there was a 2010 report from the CDC entitled Tobacco Use, Smoking and Secondhand Smoke, and it reports that about 88 million non-smokers, that's about 4 in 10 people, are exposed to secondhand smoke. Almost everyone who lives with somebody who smokes indoors is exposed to secondhand smoke. And then children and teens are more likely than adults to live in homes where someone smokes indoors. So when we look at the younger population specifically, about 54% of children aged 3 to 11 are exposed to secondhand smoke. And what we'll explore more is children are more heavily exposed at home. And then about 47% of youth aged 12 to 19 years are exposed to secondhand smoke.
So how does this all this information take into a factor of secondhand smoke exposure and how we can protect ourselves? So these are some strategies and recommendations. The CDC report, tobacco use, secondhand or smoking and secondhand smoke presents some recommendations to protect all community members against the harm of secondhand smoke, specific to doctors, nurses, and other healthcare providers. CD recommends the following: ask all patients and parents of pediatric patients whether they use tobacco and advise those who do to quit. Advise everybody to make their home vehicle 100% smoke-free at all times. This could be 24 hours, 7 days out of the week. Highly recommended. The next one advises that non-smokers to avoid being exposed to secondhand smoke, especially if they are pregnant, have heart disease, and respiratory issues. So if you step back, take a snapshot of the larger, broader picture of this, there are other protections that can be established to protect all community members. Perhaps even the ones that health clinic is not interfacing with, such as establish a policy banning the use of any tobacco product indoor, outdoor, on the property campus by anyone at any time. So basically avoiding a designated smoking section altogether. So moving that designated site away from all entries for any way of that from the smoke to be ventilated back to the building. So second, never smoke in the home again, in the vehicle or around the younger generation. And lastly, ban group activities or events in places where secondhand smoke is allowed and present. So just to think about this, 2 examples come into mind. locally for the state of New Mexico, which is kind of unique to share. We have seen within our work here in our project, we have seen most recently included with a One Pueblo Senior Center working to revise their policy that bans the transportation of seniors to local bingo nights that allow smoking indoors. Another example, another Pueblo here locally is currently processing a tribal resolution that bans smoking of any kind in the campus or within the facility where they're housing the seniors, housing either or the senior center. So other examples within the community, if you can think about, would be Boys and Girls Club, or along with this was the Boys and Girls Club, the Wellness Center, and a playground facility. So these policies help eliminate exposure to the secondhand smoke in specific places, and therefore reduces the non-smoking exposure to the toxins of secondhand smoke. So we'll jump into the third hand. So let me ask you this question: have you ever stood near someone who wasn't smoking and smelled like smoke? Well, that smell is from the third hand smoke. So if you look at the image to the right, you see a drywall within a house or an apartment that has been a person that was smoking in that setting. So this is what the effect of that over a period of time. So the definition of third hand smoke is residual nicotine and other chemicals left on the indoor surface by tobacco smoke. People are exposed to these chemicals by touching contaminated surface and breathing in the off gases from these surfaces. Third hand smoke clings, sticks onto the clothes, furniture, drapes, walls, bedding, carpeting, dust, vehicles, and any other surfaces that it can find itself to attach, along after the smoking has stopped. So if you kind of think about that, there's a lot of things that I did not mention can also be part of those surfaces. The residue from these third-hand smoke builds up on the surfaces over time. So you've got to ask yourself, can you clean this or can it be not clean? So third-hand smoke cannot be eliminated by airing out the room, opening the doors or windows, using fans or air conditioners, or confining the smoking to one certain area of the home, the facility, or the room. So this invisible toxic substance consists of gases, particulate matter, including carcinogenic, cancer-causing, and having heavy metals such as you saw before, the arsenic, lead, and cyanide. So
there was a 2013 study on third-hand smoke exposure and health hazards in children specifically, and it found that infants and children have a higher third-hand smoke exposure incidence because, number one, they typically spend more time indoors, especially in environments where secondhand smoke is present. And secondly, they behave in ways that may expose them to third-hand smoke, such as crawling on the contaminated surfaces like the couches or the carpet or the floors. And then they also put their hands in their mouths, which transfers the third-hand smoke toxins from their hands to their mouth. So a more recent study supports this research, and this study was pulled from the Journal of Tobacco Control, and it found high levels of nicotine on the hands of children of smokers. So the researchers examined 25 children who arrived at an emergency room with breathing problems associated with secondhand smoke exposure. And what they discovered is that the average level of nicotine on the children's hands was more than 3 times higher than the level of nicotine on the hands of the non-smoking adults who live with smokers. So they also found in the children detectable levels in the saliva of cotinine, and that's a biomarker for exposure of nicotine. So basically the study found high amounts of nicotine on the children's hands, and then also the metabolized biomarker of nicotine in the children's saliva. Research published in March 2016 also shows that in mice, third-hand smoke causes insulin resistance. And I want to be clear, this was a study done on mice, which is a precursor to type 2 diabetes. It confirmed, if this would be confirmed in humans, these studies could have a major impact on how people view exposure to environmental tobacco toxins, in particular to children, elderly, and people who are working in environments where tobacco smoke has taken place or continues to take place.
So some of the other impacts of third-hand smoke, just to kind of tie off on what we're talking about, or what I mentioned earlier within the housing setting. So while it is directly associated with health, third-hand has an economic impact on rented housing units. Turnover costs related to smoking and secondhand smoke. The average cost of turning over a smoke-free unit is $5,000 less than turning over a unit where past residents have smoked. Smoking-related costs such as repainting. For extreme cases, there could be repainting the wall, ceilings, fixtures, and replacing carpeting, anything that I mentioned earlier that you can think of that the environment of that third-hand toxins, chemicals, or the residue that's left behind. So that estimate cost reaches as high as $15,000. Multi-unit housing managers and public housing in recent years have recognized this value and started forming policies that restrict or eliminate smoking in housing units. In 2006, the U.S. Department of Housing and Urban Development announced a policy requiring all public housing to go smoke-free for the health of all residents. Who is exposed to third-hand smoke? So we kind of talked a little bit about this, just to re-emphasize that we're talking about the most highly vulnerable, or people that are most exposed to this, are the infants, and the children are particularly the effects of that third-hand smokes as they crawl on the floor, as mentioned, put things into their, the contaminants that they have, and then they eventually put it into their mouth. So children have a small, just to think about this, children have a small body mass. They tend to breathe faster, have less developed defensive against environmental pollutants, and spend more time basically indoors. So how can we, just like mentioned before, similar to secondhand smoke protection, preventing third-hand smoke exposure to those at-risk followers many of the following actions as I'm going to discuss here. Specific, again, for doctors, nurses, and other healthcare providers. Ask all patients and parents and pediatric patients whether they use tobacco, and advise those who do to quit. One formal way is to advise everyone to make, again, I'm just going to share make your home and vehicles 100% smoke-free at all times, 24/7, to avoid infant exposure. Parents, relatives who smoke should be advised to go outside, to possibly change their clothes if they're working in an environment that has a smoking area. Try to wash their hands, but again, just going back to saying that it's hard to eliminate this exposure as far as on your clothing. So to more broadly, again, actions can be taken to protect the environment from third-hand contaminants. Establish a formal policy that do not allow smoking to occur indoor or within 25 feet of an entrance or window of the house. So departments and agencies that manage vehicle fleets can establish policies that specifically ban employees from smoking while operating the company vehicle.
If you're more interested in third-hand smoke, in our research, the state of Maine has a concerted campaign that specifically addresses third-hand smoke. And this is this state of Maine program is a place to obtain more resources on third-hand smoke. Also, the Tobacco Control Legal Consortium also has a bibliography on recent studies on third-hand smoke, which is a good resource in reviewing really the mounting studies and research papers about third-hand smoke. So those are just a couple of resources. We spent today talking about secondhand smoke and third-hand smoke, and this final section of the presentation will review how environmental policies protect the health of both non-smokers and smokers. But first, let's have a word from the tobacco industry itself. The Tobacco Institute, Inc. was a United States tobacco industry trade group founded in 1958 by the American tobacco industry. It was later dissolved in 1998 as part of the Tobacco Master Settlement Agreement. In 1978, the Tobacco Institute commissioned a study to understand public attitudes towards cigarette smoking and the tobacco industry in general. Among its findings were nearly 6 out of 10 people believe that smoking is hazardous to the non-smoker's health, up sharply over the last 4 years. More than 2/3 of non-smokers believe it, nearly half of all smokers believe it. So at the time of this report, the industry was seeing a real significant transition in the beliefs of the general population, which was further pushing the needle of tobacco and health to a more public health problem. As the report continued, this we see as the most dangerous development in the viability of the tobacco industry that has yet occurred. So back in 1978, when this report was developed, clean indoor air, or protecting the air from secondhand smoke, was beginning to gain support. The tobacco industry recognized this as a real concern. The CDC has identified best practices in tobacco control or strategies that are proven to work in helping people quit or never start tobacco use, and providing secondhand smoke protections is one of them.
So last year, we just want to highlight something that took place throughout the year from last year, which I also attended and took part in. So the Albuquerque Area Indian Health Board conducted a series of basic tobacco intervention skills training for Native American communities. This program was supported by the Indian Health Service. So thank you for that, those opportunity to take part in that and participate in that so that I can get the great training from the facilitators that were able to take that. So we want to mention, specifically we want to mention this because here locally, this program has provided many of the community-based tobacco prevention and cessation projects in Native American communities with the skill to conduct smoking cessation intervention. I don't know if she's on the line or we cannot see if she's logged on, but we'd like to thank Teresa Clay of the Health Promotion Disease Prevention and Program out of the Indian Health Service Albuquerque area for her work in this important project locally.
So building on that, there are a lot of players creating a richer, more complex tobacco control program across Native American communities in the United States. All of these contribute to the progress of tribal commercial tobacco control, specifically in New Mexico from our perspective and beyond. Community-based programs make up the boots on the ground workers. They're making connections and truly facilitating change among their community members. It's also important to acknowledge the programs that supplement and strengthen the ongoing work in these communities, like the 1-800 Quit Now Cessation Service. There's national and local mass media campaigns. For example, I just read that FDA is expanding their one of their campaigns to include youth and e-cigarette use, so that's going to be rolled out soon. There's the IHS Cessation Services, FDA tobacco retail compliance inspections, so looking at the point of sale environment, and there's many, many other programs I haven't captured. But all of these are an important part in comprehensive tobacco control. So looking at environmental policies or clean air policies, these protect against the harms of secondhand smoke and thirdhand smoke. They also denormalize smoking and transfer the right to clean air back to the non-smokers. So these next couple of slides provide some discussion around clean indoor air policies. So the clean indoor air policies are rules. They're either formal or informal that define where commercial tobacco products can be used. An environmental policy might mean making a rule at home that no cigarette can be smoked in the home or on the patio of the home. Maybe it's an agreement between mom and dad that if either one of them smokes, they will change their clothes and wash their hands before picking up the baby. Maybe it's a rule that smoking is off limits in the family vehicle, even if the only driver in the vehicle is smoking with all the windows down. Because as we've learned, that vehicle then can be contaminated by third-hand smoke. So all of these are examples of informal policies that protect the health of non-smokers. A formal environmental policy might mean a workplace, such as a health clinic, bans the use of tobacco products of any kind on the entire campus. Another formal policy might be a tribal council or tribal leadership might pass a formal tribal policy that bans cigarette smoking in areas common for youth gatherings, like a park or a school. Another example of a formal policy might be a tribal enterprise passing a rule that bans cigarette smoking on the casino floor. Most states have passed clean indoor air laws that ban smoking in workplaces, including bars and restaurants. But New Mexico happens to be one of those states that has a clean indoor air law. However, our law does not protect non-smokers on reservation land. The important point we want to make here is that anyone can make a policy that protects their health. They do not have to be a CEO of the tribal enterprise or the director of a health center or the tribal chairman. It may not be a formal policy, but a comprehensive rule that, or a rule that comprehensively protects everyone. But each person individually has the power to make a rule that protects their home or their car from the health impacts of commercial tobacco.
Okay, so this slide kind of talks about the intake form and basically when you're in the setting of patient and questionnaire type of a thing. So Allie and I do not work in the IHS setting. However, the example provided on this slide are tools that health clinics and programs in New Mexico tribal communities are using to help identify opportunities for clean indoor air discussion. So a conversation starter, I would say, with the patients and the community members, anybody that's coming in. So this, as you can see, there's this question kind of taken out from one of the questionnaires. So as discussed on previous slides, the CDC advise healthcare practitioner, just as a reminder, to ask all patients and parents of pediatric patients whether they use tobacco. So as you can see in that questionnaire, and advise those who do to quit. At the same time, possibly get them into some type of quit program. So just kind of motivate that direction to go about quitting their habit. So again, just to highlight that, you know, the CDC recommends health practitioners to advise everybody to make their home and vehicles 100% smoke-free 24/7. Additionally, tools that can be used to facilitate the question and advisement process might include intake forms that specifically address both if the patient and the guardian is a smoker and if anyone in the home is a smoker. So this ensures that the health impacts of secondhand smoke are being captured during the intake and prompts the healthcare provider to advise on the clean indoor air.
So as an example of this tool in action, a 638 health clinic we work with in New Mexico designed and developed their own patient questionnaire that asks questions about stressors that may contribute to tobacco use. So the clinician then can refer the patient to different services provided by the tribe. So this questionnaire asks questions about personal health habits, but also explores the habits of the people in the patient's home environment. So the answers to these questions may also be helpful information for a clinician working with a patient with conditions that may be caused or agitated by an environment with secondhand and thirdhand smoke. As another example, there's another pueblo locally that trains its community health representatives, or CHRs, to ask about environmental policies during home visits. So these CHRs advise on no smoking rules inside the home for the health of the children and non-smokers that also live in the home. Our program, Smoke-Free Signals, offers simple window and car signage to CHR programs statewide based in New Mexico, so they can offer residents inside the homes a tool to remind those around them of their own smoke-free policy in their car or inside their home.
Okay, so just to focus in on one example here, so for the IHS clinics and tribal programs, they such as if they offer cessation counseling and services, this is another opportunity to discuss environmental policies. So part of those strategies and opportunities in the client's home and car. So for example, we have provided support to a local community, again, specifically to the Pueblo Vesleta program called Thinking About Quitting program.
So this program is based out of the community's health center, and it's offered by their full-time health educator who provides both one-on-one cessation counseling and group-based freedom from smoking quit sessions for community members. And anyone familiar with those two curriculums, they're both out of the American Lung Association. The health center pharmacy offers cessation pharmaceuticals, as well as the cessation program provides free nicotine replacement therapy for anyone enrolled in the cessation classes. And then in addition, the health educator also publishes regular articles about the QUIT program and living smoke-free in the community newsletter. So this example provides kind of a community-wide holistic approach to cessation services. So it's the health educator who's driving much of this action at the Pueblo of Vesleta, but these efforts are supported by a number of resources. The New Mexico Indian Affairs Department historically provided funding to Vesleta to provide their freedom from smoking cessation services. The health organization, American Lung Association, provided the training and curriculum for the cessation program. And then there's also collaboration across, the clinicians making the referrals, the local pharmacy providing the cessation pharmaceuticals. Key here is that collaboration is part of all of this. That collaboration is the success related to this cessation program.
So another form of smoke-free environment strategies as apply example for would be the smoke-free pledges. So I've seen locally the use of smoke-free environment pledge cards. In this case, health educators attend community health fairs and other events throughout the community, ask parents, grandparents, anybody that's attending this event, other community members to verbally, or actually even more so, get it on paper, sign pledge cards, making their home car smoke-free. So they distribute the smoke-free space, and as you can see, Are You Doing Enough is a campaign locally here in New Mexico that provides these signage, or whether to post up in their home settings or in their vehicle. These are just a couple of the ideas on how to facilitate and a discussion that empowers community members to make their own clean indoor air rules.
This final example we wanted to share during this webinar is an example from the Navajo Nation, and this is more of a story because it involves multiple years, multiple collaborators, and the story really shows how building on efforts year over year can make comprehensive environmental changes within a community. So today we've shared a few tactics on strategies that some tribal community health programs have taken to empower environmental policy change. And this example, as I mentioned, is specific to Navajo Nation. So back in 1998, the Tobacco Master Settlement Agreement was entered into, originally between the 4 largest tobacco companies and the attorneys general of 46 states. The states settled their Medicaid lawsuits against the tobacco industry for recovery of their tobacco-related health care costs. In New Mexico, we have something called the Tobacco Settlement Permanent Fund, and that was established by state statute in fiscal year 2000 as the result of the legal settlement between the tobacco companies and the state of New Mexico. Settlement payments are placed into a program fund that can be spent on a variety of health-related programs appropriated through the state's annual budget process. And the committee that's responsible for that earmarked in 2007 $500,000 specifically for tribal programs, and that was appropriated to the New Mexico Indian Affairs Department, which is a cabinet-level state agency that serves the interests of New Mexico's 22 tribes. In 2008, there was a nonprofit organization called Osa Vista Ranch Project that received funding from the Indian Affairs Department that was appropriated funding through the Master Settlement Agreement. So that nonprofit developed a youth empowerment-based tobacco prevention program in Navajo Nation. This program started a conversation about commercial tobacco, and specifically in the Pine Hill and Rama Navajo area. The youth-based program graduated to additional support from the New Mexico Department of Health, which helped bridge chapter meeting conversations about commercial tobacco. And then in 2011, Navajo Nation President Ben Shelley signed an executive order defining a policy to establish a commercial tobacco-free environment in all workplaces and public places in the Navajo Nation. So this nonprofit was able to provide education about the dangers of secondhand smoke and follow-up presentations with proposed clean indoor air resolutions at each individual Navajo chapter level. So this gradually expanded to Navajo chapter communities, and at the end of 2017, they had reached nearly 100% of Navajo chapters based in New Mexico, all of them adopting formal tribal resolutions for clean indoor air.
So just within this slide, so you see that applied example, just to go further with this, the clean indoor air policy. So on the left is the implementation of the HUD strategy and a toolkit that's available online, also from the HUD Housing and Urban Development website, and also at our website, so you can go to that. When this rolled out, again mentioned earlier in 2017, apologize for that, smoke-free housing for any public housing authority. So one thing just to make note that while the policy came out of the housing of public and tribal housing, the policy did not cover tribal housing as written. So there's some work and discussion that it's going to be moving in that direction. However, just to stay on the specific to the story, the Navajo Housing Authority considered the federal policy as an opportunity to begin a transition in 2017 to implement tenant education training courses about the harms of secondhand smoke. Again, this took collaboration from NHA and its leadership team and the nonprofit from Osa Vista Ranch Project, supported from and backed up from the New Mexico Department of Health and New Mexico Indian Affairs Department. So along with the American Lung Association. So multiple groups, you can say that they collaborated, working together to create significant shifts in the environmental policy.
So just a summary of what we've discussed today. Secondhand smoke from combustible commercial tobacco products has significant health impacts on non-smokers, including cardiovascular health, respiratory health, SIDS, ear infections, and dementia. We also noted that children and youth have an especially high exposure to secondhand smoke. Looking at third-hand smoke, it's a relatively new term in tobacco control, and it's a toxic substance that presents health hazards, especially to infants and children who spend most of their time indoors. Recent studies show that children exposed to third-hand smoke have higher nicotine levels on their hands and traces of nicotine exposure in their saliva. And finally, we looked at environmental policies, such as clean indoor air rules. They are an effective strategy to protect the health of non-smokers. Many tribal communities have adopted comprehensive environmental policies. We provided a few examples today. And there are a number of programs that have successfully implemented informal protective policies. I think what's important here is that collaboration is essential to creating environmental policies. It takes a lot of people to generate a comprehensive policy. All right, so we just want to thank you all for the opportunity to share with you today. It looks like we have about 15 minutes remaining in the webinar, and we'd welcome discussion from the group or questions from anyone attending today. Also, on the bottom of this slide, I have our website, smokefreesignals.com. A lot of what we addressed today, specifically related to policy, is there's a number of toolkits, how-to guides, implementation policies, and also some free media that is loaded to that website. So if you're interested in learning about how to move forward with a policy in any of the spaces we discussed, smokefreesignals.com is a good resource to begin. Thank you.
Thank you.
All right, thank you very much, folks. Well, we're going to go ahead and get started on some question answers. We'll go ahead and do that until the top of the hour here. If anybody has questions, feel free to enter your questions into the question box in your GoToWebinar control panel. You should see a little line there, or a tab that says questions. You can click that, and then you can type your question into the GoToWebinar control panel. It'll pop up on our side here, and I'll be able to read it off for Allie and Jovian to go ahead and answer here. So our first comment here is, I'm a staff member with the programs here in Maine. Thank you for giving us the shout out and sharing our THS resources. Next question is,
yeah, we're happy to have you.
Our next question is, what is your advice for an employee who works at a health clinic and the staff is allowed to smoke outside the clinic still on the grounds? Employees who like to walk during breaks have to pass through the smoking area, which could affect their health over a long period of time.
Mm-hmm. I think that's a really good question, and probably that's a common situation for a lot of people. I think looking at some of the recommendations that CDC offered is, I don't know if it would be possible to approach the facility manager or the person responsible for placement of the smoking area and talking about moving that smoking area to a different place that's not impacted on the walking path. Or another thing would be to approach perhaps it would be the facility manager, maybe it would be the director of the department, to explore a policy that that bans smoking curb to curb. So in that case, the campus or the grounds where that building is located would not allow commercial tobacco smoke in order to protect the health of people that are in the area. Those would be my recommendations. I don't know if you had anything else to add. And you know, I'll tell you that this is more from the multi-housing perspective, but we work closely with the American Lung Association in New Mexico, and a lot of the multi-unit housing managers, so large apartment complex property managers, are looking at going smoke-free curb to curb. And a lot of them are concerned about the, you know, what are the legal consequences of going smoke-free within a residence. And what we're finding is they have every right to go curb to curb smoke free. So they're not they're protecting the health of everyone that's on the property.
All right, and then we've got another question here. This one was directed to Allie. This person says, during the introduction, you mentioned groups that were being targeted with advertising and that these groups were at increased risk for health problems related to second and third-hand smoke. In listing those groups, you included the LGBTQ community as those targeted and at higher risk. I understand the targeting, but I don't understand the increased risk of this community, i.e. greater than the risk of non-LGBTQ.
Okay, thanks for that question. This I actually pulled from, this was from the, okay. Yeah, thanks for that question. I actually don't have the data source that I pulled that information from, but I think what I'd like to do is research that a little bit more, where I was coming from that. I think when you're looking at tobacco use rates among those with social justice issues, the LGBTQ communities have higher use rates, and because of those higher use rates, there's a connection to a greater burden of disease and death because of the exposure to the secondhand and thirdhand smoke. But I want to be as sensitive as possible in sharing that information, and I'd like to follow up with some, the research that I pulled to share that. And I will do that. I commit to doing that.
Okay, and Allie's contact info is still listed up on the screen here. So if the person that asked that question would want to maybe send Allie an email, would that work for you, Allie?
Yeah, absolutely. And thank you.
And then this next person asked about the slides being archived. Just to remind everybody that there's a PDF version of both the resources and the actual PowerPoint presentation up right now as a resource in your control panel that you can download. And then we will be archiving the video of this webinar immediately afterwards, and we'll have it up, hopefully, if not later on this afternoon, which I do believe we should. It'll be uploaded onto the website no later than tomorrow for sure. So we're going to go ahead and get all of this stuff archived and up on the website, and there's actually an archive tab on the left side of the keepitsacred.org, our website. And then also just a reminder as well that folks that are interested in continuing education units, that are interested in CEs, we're going to send out a post-webinar evaluation tomorrow. It'll be automatically distributed through GoToWebinar. Just click the link that's going to be in the email that you'll receive tomorrow, and you'll be able to complete the post-webinar survey. And when you do that, make sure you include your contact info in the last part of the survey, and we'll go ahead and get you set up with CEs, with the continuing education units there. This person says, where can I find more information about confirmed health impacts of THS? I want to design a poster or brochure on this and had difficulty finding good data about this.
That's a good question. First of all, I think, available for download is a resource list. So that is the list of resources that we pulled in putting together this presentation. That will connect you to some of the resources specifically related to thirdhand smoke. And then the Tobacco Control Legal Consortium has a bibliography of thirdhand smoke resources. I want to say there's probably up to 30 studies and research guides in thirdhand smoke. And so that visiting the legal consortium, you can identify a bunch of sources there. And then I also mentioned the Maine program. The state of Maine has some interesting thirdhand smoke campaign materials that may be also a good source for information.
Excellent. This person asks, how do you enforce no smoking areas?
Well, I mean, it really depends on if it's a informal policy or a formal policy, but, you know, an informal policy, you might use tools like smoke-free area signage. Like here in New Mexico, we provide free signage for buildings, homes, and cars. So the person implementing an informal policy can use those, point to those to help enforce it. But I think another really important thing that is even at the state level, people forget is that enforcement is a really important part of policy development. So when you're looking at, I want to create a formal smoke-free policy that impacts my building or that impacts my workspace, really take a consideration at where that enforcement, or who would be responsible for the enforcement. Is it the supervisor of the employee in violation? Maybe it's the facility manager that's responsible for enforcement. So identifying the who is responsible and the consequence of it. And that's really important in developing the enforcement policy. Some of the implementation guides that we mentioned during the PowerPoint, those are all loaded on the smokefreesignals.com. The implementation guides will provide some guidance on how to implement a policy and also how to consider enforcement of a policy.
Excellent. We are going to be getting close to the top of the hour here, so we're going to start wrapping it up. I probably have time for just another couple of questions. So just to be respectful of everybody's time, we're going to probably wrap this up at the top of the hour. This person says, currently, American Indians and Alaska Natives have the highest rate of tobacco use. Why do you think that is? What do you think is needed to decrease rates in these high-use areas?
High use?
Yeah. That's a really good question, and I think key to that is the following CDC best practices for comprehensive tobacco control. So at the community level, ensuring that commercial tobacco use is a conversation that's happening first and foremost. And then ensuring that there are prevention practices in place to prevent the use of the adoption of commercial tobacco use among youth. So that's also looking at like protective factors, doing after school programs, empowerment programs, things that protect against the use of the initiation of commercial tobacco use. The second is ensuring that there's cessation services. So if your state has a quit program like the 1-800 Quit Now, ensuring that they're talking about that, or providing referrals to the cessation services. If the Indian Health Service clinic or 638 Health Center has a cessation or pharmaceutical available for people willing to quit, that's really important. Making sure clinicians are referring to those cessation services is really important. And then another effective strategy is clean indoor air. So finding ways to either personally or encourage clean indoor air policies at the personal level, so in the home environment or the car environment, or more broadly, that may impact the health center or the parks in your area, or maybe the tribe is ready for a tribal resolution that looks at clean indoor air. So prevention, of starting tobacco, helping with quit services, and ensuring there are clean indoor air environments.
All right, and then this other person had mentioned that that they've also got resources from Maine that folks can visit their website at breatheasymaine.org. Breatheasymaine.org. And this last question here, it says, I do not see any information on SHS or THS in my area. How can I find out where I can get help or information in my area?
What area would that be?
Yeah, if that person can send me or Jovian an email and just identify where your area is, we can do some research to connect you with some of those resources. Yeah, the foundations or A&R, Americans.
Yeah.
Go ahead, Jovian.
A&R is also online. That's nationally to where they can go to the website. So the A&R stands for American for Non-Smokers' Rights. So they have a national website that kind of highlights data, surveys, and at the same time provides information as far as secondhand and even into thirdhand. So just to kind of add into the gaps where Allie mentioned earlier. So that's one great website that you can go to. I'll also mention the CDC, American Lung Association, the American Heart Association. So what else was there? I'm trying to think. And then at the same time, you can also look into the information as far as the HUD website. That's also a good resource. So. And then specifically to areas to where it may be focused to the work area specific to gambling would be also the A&R also has a web link to the Smoke-Free Casinos campaign to get that. So those are just a few. And if you have any questions on specific to those websites, you can email me and I can send that off to you, just specific to those questions that maybe we haven't addressed yet. So.
All right, great. Well, we want to thank everybody for attending today's webinar. Again, we do want to remind folks that there will be a survey emailed out to everybody tomorrow. Just click the link in the email and you'll be able to complete the evaluation. And folks that complete the evaluation, if they fill out all their contact info and stuff on there, we'll be able to get them set up with continuing education units, their CEs, for completing the webinar. And of course, we want to thank everybody for attending the webinar. Folks that are looking for archive material from today's webinar can find it at keepitsacred.org tomorrow. We'll make sure that we get the video of this webinar, the presentation slides, the resources, all that good stuff, all on keepitsacred.org. Feel free to follow us on social media, facebook.com/keepitsacred. Twitter.com/keepitsacred or at keepitsacred, and LinkedIn.com/company/keepitsacred. Again, we want to thank everybody for attending, and we're going to go ahead and wrap it up. Thank you very much, and have yourselves a great day.